Hi, welcome. You're watching One India News, and we are coming to you on the evening of Christmas and on a big day that Prime Minister Modi has made three big announcements concerning India's vaccination program. And they are that from January 3rd, 2022, those in the age group of 15 to 18 will get COVID vaccination. Uh, so far, only 18 and above, the crowd 18 and above was getting vaccinations. From January 10th, 2022 onwards, all healthcare and frontline workers will also get a booster jab, which the Prime Minister called a precautionary dose of vaccine because they're at the front lines, they're tackling Omicron and the COVID pandemic has not ended. And from January 10th, those who are above the age of 60 years and with comorbidities, they can also be eligible for a booster dose of vaccine, provided their doctors give them that recommendation. So there are three groups of people, three groups of vulnerable people who are eligible for either a booster or their first doses of vaccine. Big announcements today. India is joining a league of countries who have already gone ahead and implemented these measures. So, Akash Mehtal, my colleague, is also joining me on the broadcast. And Akash, we are catching up with others. This is the right time for India, but other countries have also gone ahead. So, what's the global picture like as far as vaccination and booster doses is concerned?
Yeah, absolutely, Deepavali. A very Merry Christmas to you and all the viewers who have just joined it at a very late evening. Everybody was taken by a surprise. Just 15 minutes. Prime Minister PMO office just gave a 15-minute window to everybody. There was a quick tweet by the PMO saying that the Prime Minister will be addressing the nation before in just 15 minutes. Everybody was thinking what could be. Of course, everybody knew that it would be somewhere around COVID-19 and with the emergence of Omicron cases, and the Prime Minister very rightly and very aptly said to the entire nation today that there is no need to panic, though the Omicron cases are on the rise. But we also need to see this trend that the overall COVID-19 cases in India are on a decline, which shows that the vaccination is utmost important for everybody in the country right now. That is what the PM has emphasized. Do not panic. And of course, one thing very aptly, Deepavali, the Prime Minister also pointed out is that the need for using the mask, which nowadays across the board, across India, people are, because there is a laxity of using of mask. And of course, a very funny thing happened. Just day before yesterday, me and one of my friends were having this conversation, and we were talking that people have actually stopped using hand sanitizer to a lot of extent. People have, there was, when the COVID-19 started, there was a outrage. People were like hoarding these hand sanitizers like they were off the shelf, like within 15 minutes of them when they arrived to your chemist shop. But now they're just lying there, eating dust because nobody cares about it. That is one thing that the Prime Minister said, that it is very important for everybody to keep on wearing masks,
Yes.
keep yourself sanitized, use hand sanitizers. And that is what the Prime Minister initially said. And when what he said next, you just told all our viewers today that one thing that everybody was asking, that when will the children be vaccinated. So today the Prime Minister said that between the age of 15 and 18, the children will be getting their first jabs from the 3rd of January of 2022. And of course, the booster shot, which was the need, which was demanded by a lot of medical experts across India. They were saying that as Omicron is coming and most of these other countries are are telling their citizens to get their booster shots, because let's be very honest, Deepavali, most of the cases, like England, UK has more than 1 lakh cases per day being reported, and most of these cases that are being reported are of the people who are unvaccinated. So that is the biggest concern for Europe right now, that people are not getting their vaccinated. There's an anti-vaccine drive that is going on in Europe, which that is the reason why they're facing a lot of problem when it comes to vaccine.
Right.
But a good news, children will start getting their vaccines. And of course, India is going to join a long list of nations who have actually started doing it. Ecuador was the first country in the entire globe which has made it mandatory for children to get vaccinated. And of course, China, as we know, they have their own parallel system. So China basically have started giving vaccines to the children from the age of 3 to 18. So that is where China stands as of now. US and Canada, of course, they have approved Pfizer for children, and countries like Germany, France, and Sweden, they have also started giving vaccines to the children. So India also now joins a long list of nations that have started giving vaccines to children. Though there are currently there are just two vaccines that are there. One is Zycov D, that is one vaccine, and another one is Covaxin, which is which was today itself. It was basically cleared for emergency usage for
Right.
children.
Now that Akash, you mentioned there are anti-vaccine groups and all, but the vaccine politics has also begun in India with the Prime Minister's announcements. There are many people from opposing political groups who have now joined TV channel discussions saying the timing is not right, it should have been done sooner. But the good news is that it has been done, and most experts from the medical community and many of these CEOs of biopharmaceutical companies who are joining in these discussions online, they say that the timing is absolutely perfect, considering that the Omicron variant is now outpacing Delta very fast. So the timing is right concerning that. Also, that India has achieved 61% vaccination of both doses. For 61% population has been vaccinated with both doses. And in many of the states that attract tourists a lot, that's something Prime Minister mentioned in his speech, some of the states have achieved 100% vaccination with one dose. States like Himachal Pradesh, Uttarakhand, and Goa was mentioned by the Prime Minister in his speech earlier this evening. So, considering that a large part of the population has been covered, India can now move on to and focus on the next group that is still vulnerable, a huge group, no doubt, all children between the ages of 15 and 18. And of course, looking beyond that, we also have to vaccinate children who are younger than that. But the news this evening comes as a huge relief for parents who have been taking quite a risk sending their children off to schools without protection in terms of a vaccine. Of course, everybody is wearing masks and following COVID protocols, but there is a certain risk involved in sending your children out there in the world, out to schools where they're going to interact with others, and there are chances of contracting the virus, especially in this season where Omicron is raging. So that is a huge relief for the parents. And vaccine politics, although it's raging, and it is going to carry on as far as the future is concerned. However, this is definitely comes as a very welcome news that India has opened up vaccination, and more importantly, the booster doses for its vulnerable populations, for the frontline workers, and for those aged 60 and above. Especially since India had started vaccination for healthcare workers on 16th January earlier this year, the time period it's been a long time period now that the chances are there of vaccine efficacy wearing off, because most vaccines are effective, most flu vaccines are effective for about 6 to 8 months. I'm not very sure about the figure, but definitely they don't last a whole year. So that is why you have to get flu jabs every single year. It's an annual thing. And perhaps with COVID now becoming the new normal, perhaps that is going to be the new normal, that there will be a booster vaccine every few months. But for now, that booster is only reserved for people above the age of 60 and with comorbidities, as well as frontline workers. The question now, Akash, it's also that uh, whether the vaccine doses that are going to be administered are going to be, what the rollout is going to be like. Whether those who have got Covaxin will get Covaxin, whether those who've got Covishield will get Covishield. So all of that is still to be made clear. However, the Prime Minister has made the big announcements, and in the following days, we will obviously get to know how the rollout is going to be, what is going to be the roadmap of vaccinating our youth
Absolutely.
and giving the booster doses to our elderly.
Exactly. They probably very aptly pointed out the Prime Minister has basically covered all the major pointers. But the now what everybody would be eyeing for is the because every few days the health ministry they do they do come out, they give a bulletin, so everybody will be eyeing for that. Hopefully, they will be coming out tomorrow with the health bulletin, and of course, there might be a press conference from the health secretary also, who will give out the nuances, as you said, that what kind of booster doses. So, of course, there were experimental. The mix and match of the vaccine, those kind of experiments were being carried out a few months back. The doctors were testing so that if there is a shortage of one vaccine, you can always do a cocktail of vaccines, and they were testing out that was it possible, and there were few successful cases also. There was this 66-year-old gentleman in Haryana, in Gurugram, who was given a cocktail of vaccines, and who he was COVID positive, and he came out with flying colors out of that. But yeah, we need to see, would India be still going for that same kind of a pattern, going for cocktail vaccines, or will be somebody who is administered Covaxin will be given Covaxin, somebody has taken Covishield, somebody who is fortunate enough to take Pfizer, will they go for Pfizer or something like that? We need to see that. But yes, the Prime Minister has given bigger news to the people. And one thing they said is the politics over the vaccines. Well, when the Prime Minister, in late 2020 said that the vaccine will be coming out, from the day go, there were politics about that also. Parties coming out, some people saying, "Hey, we won't get the vaccine because this is a political party vaccine," and everybody was defending that, hey, it's a vaccine. It's not a political party's vaccine. It is a vaccine. It's up to you. If you want to use it, you take it. And I think and I hope that people who were first very adamant of taking the vaccine because taking politics over it should have and must have taken their vaccine as of now. And yeah, yeah, and very few interesting points also. The Deepavali Prime Minister, assured the country also, because there was a little bit of panic. Let's be very honest. If we go back 1 year, by the year 2020, the same time, everything was back to normal. Everything was open. People were happy and jolly. We were, celebrating our New Year's. We were celebrating our Christmas. Come April of 2021, the things hit the fan. Everybody was back into the lockdown, and there was a huge, huge oxygen shortage across the country. And it was very unfortunate that thousands and thousands of people actually lost their loved ones during that second phase of COVID-19. So the Prime Minister came out today and he said that we are fully prepared. According to the Prime Minister, India currently has 18 lakh isolation beds, 5 lakh oxygen supported beds, 1.40 lakh ICU beds, 90,000 pediatric ICUs and non ICU beds. And the Prime Minister said that we have around 3,000 working PSA oxygen plants. 4 lakh oxygen cylinders have been distributed throughout the nation. So the Prime Minister has assured people not to panic. Omicron is a new variant. WHO has time and again said that yes, it is a new variant. It is a variant of concern. We don't know much about the variant as of now, but let's not panic. Let's stay focused, and let's adhere to the COVID protocols as of now. That is what the WHO has also said time and
Right.
again, Deepavali.
That's right. And the fact that Omicron has so far been seen to escape vaccine protection, even that's not a reason not to get the vaccine, because all medical experts agree that vaccination has taken the sting out of how deadly COVID can be. So anybody who's vaccinated has had less severe COVID-19 disease than someone who has not been vaccinated. The studies are clear about that. And so far, in fact, it's not very clear whether vaccines are 100% effective against the Omicron variant, but it definitely does serve to make the disease milder. And Omicron is giving people a milder form of COVID-19. It's not as severe as Delta, so that is a ray of hope. But that does not mean we bring our guards down, because COVID-19 is still out there and it is prevalent. So also, Akash, I would like to mention, like you said, that India has already, it has its resources now. Everything is in place. There are isolation beds. There are oxygen-supported beds. India has its oxygen. We were gasping for air back in May 2021. Now, oxygen, ICU beds, everything is in place. India has ramped up its resources. It has worked hard over the last several months to prevent another cycle of such a nature that we saw back in the summer months. So all of that is in place. Plus, India also had surplus vaccines, which it had started exporting, it had started giving to other nations. So all those things are in place, and now seems like the right time to start giving vaccinations, looking inward and start giving vaccinations to its own population, our youth population 15 to 18, and of course below that even, is so huge. It's the significant part of India is our youth population. So it is a good time to begin this. The children have been sitting at home for the last 2 years, and doing online classes, which we know is not effective, which we know, children lose their attention. They have not got education the way it is supposed to be. They've missed out on social interactions. They've missed out on their, getting to know their peers, on a holistic education. They've missed out on that. So it is important that now, with the vaccines, schools can finally reopen the way they are meant to. Our children, kids can start going back again. And the threat of Omicron, the threat of COVID-19 does not again shut down our schools the way we have seen over the last several months. So the timing is absolutely right. I'm sure all parents that I also personally know are going to be happy. Once the vaccination, we don't know how long this is going to take, because the number of children is huge in this particular age group. It's immense. So how long the vaccine coverage is going to take. And of course, I come back to the rollout again, because before this, the app, the Arogya Setu app, these apps were the COVID app. These were the ones that you had to log on to book your slots. So whether that is the same roadmap we have to follow this time, all of that is unclear. And like Akash, you mentioned that the health ministry briefing is expected perhaps in the next few days, and they will clarify more on these points. So the coverage of our youth population, that is going to take time. And whether they will, again, whether schools are going to have vaccination outlets there, whether there'll be mobile vaccination points at schools itself, that is another point we would like the health ministry to clarify, or whether children will again have to go to these medical centers to get their vaccinations. So all of this is awaited, but the news that the vaccination has been opened up is absolutely welcome. Also, Akash, the Prime Minister mentioned that an intranasal vaccine is also coming up in India. So an intranasal vaccine is also welcome news, because that, as far as I understand, it reduces our logistics problem. It also reduces waste, because there are no needles, syringes involved. Also, if you're afraid of syringes, then nothing better than an intranasal. And there are reports that say that they offer better protection, because it directly goes into the mucous membrane, which is the place where usually the virus enters through our noses, or through the mouths. So if it the intranasal vaccine affects that area, and at the point of entry of the virus, that's where it attacks it. So
correct.
So this is
lot of Deepavali, we are talking about our nasal vaccines, of course, Zycov D, which is one of the vaccines that has been approved. So that could be given through syringe, and that could be also taken, without the syringe. So that is like one of those vaccines that could be inhaled. Of course, London, England has actually started, working on capsule vaccine. So maybe in a year or two, it could be an over-the-counter prescription kind of a COVID vaccine. So it will just become something like a cold or cough that we have in modern times. You have a cough, you go and you buy a syrup. You have cold, you go and you have thousands of over-the-counter medication. So hopefully, in years to come, we'll have something like that. And of course, the Prime Minister also said that we are working on a DNA based vaccine also right now. So all of these vaccines that we have right now, they're all RNA vaccines. What the scientists are now working on DNA vaccine. So how the DNA vaccine works, Deepavali, is it's very simple. So it basically trains your body. So like if you go to a trainer, so like if you want to learn yoga, so you'll go to a trainer, he will tell you the steps, and you learn those steps, and then you know how to do yoga, right? So you, in a year or two, you can yourself become a yoga instructor, because you know the basics, and now you know how to exercise yoga. So same thing these DNA vaccines does to your body. They go inside your body and they train your body to understand what kind of a virus the the COVID-19 vaccine looks like and how to fight against it. So the next time the virus comes inside your body is ready to fight that virus. So that is how these DNA vaccines work, and that is why these are considered to be much more easier and much more prolonged, result oriented vaccines as compared to RNA vaccines that we have right now, for which you have to need to get booster shots. So if DNA vaccines are developed in a year or two. So just like hepatitis A, hepatitis B, and all those kind of vaccines that you get once in a lifetime and then you're done with it. So that kind of a thing. I think that would be one important giant leap, I must say, for everybody, because this pandemic has turned the world upside down. We can see China right now. Xi'an is one of the districts that they have put into lockdown. 1.3 billion people once again in lockdowns, and of course, winter sports are about Olympics are about to begin in February of 2022 in China, in Beijing. China is trying the level best to curb the virus that is there. Even just two cases, the Chinese administration, they turned down. They put the whole district into a lockdown. So that is how they have the zero COVID policy over there in China. United States, of course, they have the vaccines. They have everything, but the hesitancy is still there. The people are not taking their vaccines. Thankfully, over here in India, people are a little bit more sane in terms of taking the vaccines, and they're taking the vaccines. They are going and they're taking the vaccines, and that is the best part. And that is the main reason why the public, even though the cases are rising, we have 215 cases today. What the health department bulletin in the morning today said that 415, cases were administered. Yesterday, what I checked, 114 people were treated and they were discharged. So that was yesterday's number that I'm talking about. Not sure about what was today, but yesterday it was 114 people when the numbers were around 358. 114 people were actually discharged because they overcome the Omicron variant. So of course the variant is there. People need to be much more vigilant about it. They need to wear their mask, and of course people who are living in Delhi nowadays, let me tell you, the very popular market Sarojini Nagar, they are now going to run on odd and even numbers, because hell lot of people are there on the market in the market. Of course the new year is there. I can understand people want to enjoy their this thing, but yes, definitely. But good news coming in for everybody, especially for children. Parents were a little bit worried sending their children, and they said, hey, here's the vaccine, take it and be a little bit more chilled out about everything. So a good New Year's gift, I must say, Deepavali, from the Prime Minister to everybody here in India. And of course, booster shot getting open for healthcare workers. Hopefully, down the line, within 2 or 3 months, everybody would be eligible for booster shots. We just need to check what will be the guidelines set by the government about that.
Yes, and one last good word about the vaccine program that India has been running. The Prime Minister was also used many glowing words about it, saying that the all kudos, all credit goes to the healthcare workers who are on the ground administering the vaccines, and all those foot soldiers who are bringing people out of their homes to get vaccinated. So without them, all this wouldn't have been possible. Wherever we've got so far, India's vast populations, India's vast geography also, and it's largely rural population where such awareness about vaccines does not exist. To get them to come out and take these shots has been a Herculean task, which has been achieved to a great extent. 1 billion doses to be achieved by October, when our vaccination program had started by 16th January this year. That is a huge feat. So yes, onward and upward from here. Hopefully, it's been a very good track record. So we hope to continue this. We hope that the momentum will keep going.
Absolutely, very true, Deepavali. And well, on that note, we will like to thank everybody who has joined us today. And we still got a few 1 hour left. So Merry Christmas once again to you, Deepavali, and to everybody else. Prime Minister chooses very interesting days to come out with his
Oh,
with
yes.
his speeches and with all his announcements. So yeah, when I just heard, I said, hey man, it's like it should not be like the November of 8th.
2016.
Exactly.
Who doesn't
It should
remember that?
exactly. So well, on that note, thank you everyone who joined us, and thank you Deepavali and everybody in our team, who just rushed in once again, and we were able to do this live.